Good morning, student. Today we are going to see about the coronavirus disease, or the what we call popularly, that is the COVID-19. Last 6 months, whatever we have experienced all over the world is about the coronavirus disease. Initially, that is started in the China. Nobody have imagined that will take the final stage as like the pandemic that is happening all over the world. In the series of these communicable diseases, we'll be going through the whatever we are discussing, the learning objective in relation with this particular lecture. First step, we will be seeing about the origin of the coronavirus, how it has started from the China, what is the source of infection, whatever the mode of the transmission, then how the human to human transmission that has occurred in relation with the coronavirus. The next part is the in relation with the epidemiology, is about the clinical features, signs, symptoms that we will be discussing about the coronavirus. Whatever the laboratory tests that are available in relation with the coronavirus, that also we will be discussing in this particular lecture. And the last part will be concentrating the whatever the thing that is in our hand to control or to prevent the further spread of this epidemic, is about the preventive measures and control measures. As far as the management part is concerned, we will take the overview of the whatever the medicine that have been tried till date, still we are experimenting, till there is a trial and error that is going on in relation with the various already available drugs. There is no any new drugs as such. Whatever the drug that are used for the other diseases, that we are trying for the treatment of the corona, that part will be taking at the end of this lecture. So to begin with, the coronavirus disease that has started in relation with the China. So the as everybody of we are aware, what is this coronavirus? It is a viral disease, also called as the COVID-19. Why 19? Because has been detected in the year 2019. It has started in the city of Wuhan, Hubei province in China, from the late December 20, as we are aware about this particular thing. And it was declared as a public health emergency condition, PHEIC, on January 30, 2020 by the WHO. So to begin with, we will give focus on the whatever the sequence of event that has occurred in relation with the coronavirus. Then we will see the epidemiology, clinical features, preventive part, and lastly we will be discussing about the treatment part in relation with the coronavirus. So this is what is the picture everybody of you might have seen on the television, on the internet, and on the various social media too. In December 8, 2019, the several cases of what has happened, how this particular thing has begun. Several cases of the pneumonia of unknown etiology. So the what is the main feature is the patient developing the pneumonia that has been reported in the Wuhan city of the China. And in the early stages, the pneumonia, severe acute respiratory infection symptoms occurred with the same patient, and they land up into the acute respiratory distress syndrome or the acute respiratory failure, and then other serious complication that has resulted in relation with the COVID-19. Where did it happen? As already we have discussed in the map, also you can see here the Wuhan city in China. And then we are going to discuss about the origin of this virus. So what in this particular picture you can see is the Wuhan seafood wholesale market, where the live animals were also on the sale. So the most of the patients who are suffering from pneumonia of the unknown etiology, they lived around this particular market, wholesale animal market, in the city of the Wuhan. Is it like that the coronavirus is a new thing? It's not like this is a new virus. Coronaviruses didn't just pop up recently. they are the large family of the virus that have been already around since the long time. So this is one of the important thing that we have to remember. Then on January 7, the Chinese authorities identified a new coronavirus as a cause of the pneumonia outbreak. The new strain was named as SARS coronavirus 2. The infection with this virus is new pandemic. The SARS coronavirus 2 disease, COVID-19 disease, which may present with mild, moderate and severe illness. So when we will be discussing about the clinical features of the coronavirus, the presentation of the coronavirus, at that time we will understand the number of cases or the percentage of the cases that are having the mild infection, the percentage of the cases that are developing this moderate, and the very few percent of the cases of the coronavirus that will land up into the complication that we have discussed, that is the acute respiratory distress syndrome or the pneumonia. So the one thing that we can keep in mind, that coronavirus can present in the three form. One can be the mild, moderate, or few number of the cases the severe illness that will be present. As far as India is concerned, India reported the first positive case of novel coronavirus in January 2020. I hope you might have listened in the news, that is the origin or the whatever these cases, the 2-3 cases that has occurred in the Kerala, they were the student who returned from the Wuhan University. So naturally, the first ever, the first cases that has been reported in the India, that also having the origin in the China. I have tried to update the recent number of the cases, and here you can see, as far as the map of the India is there, this is the updated figure of the 25th of August 2020. Now today again the 2 days has passed and these figures definitely are increasing. Roughly we can add 60 to 70,000 cases per day. Whatever the cases that are occurring at present in India is, we are adding approximately roughly 60,000 cases are added daily. So even this picture can give us guideline of what is the current situation as far as the corona in India is concerned. We can see the Maharashtra is leading with around 7 lakh of the cases. Then the next is Tamil Nadu, followed by Andhra Pradesh, Karnataka, and now even Uttar Pradesh is having around approximately 2 lakh cases of the coronavirus. In total, around 31,000 cases that are confirmed cases. Death that has been reported till 25th of August. Some death might be added in last 2 days also. So around roughly we can say more than 58,000 deaths that has occurred in India till now. But one of the figure that we should not ignore, that is the recovery is also good. More than 24 lakhs of the cases that has also recovered because of the coronavirus as far as the India is concerned. Now we'll look at the global situation in relation with the coronavirus. The worldometer, that is site where from this figure I have taken, roughly the coronavirus cases that are reaching around these, this is the figure. Death as far as the all over the world is concerned, 8,17,000 deaths that has been reported, and again here also the recovery figure is good. As far as the ranking of the country as coronavirus infection is concerned, you can see in this second part of this table of this corona situation, USA still ranking number 1, Brazil at second position, and at present India is at the third position as far as the coronavirus cases is concerned. Then it is followed by Russia and South Africa. But not only the ranking that is important, you look at this column, what we are seeing, the number of new cases are now declining in USA. That is the new cases. This is again figure of 25th of August, 358 cases that has been added. But what you can see in this column is now India here added approximately 6,000 cases on that particular day. So this is again one of the concern, and that we have to take the preventive and control measures in relation with the coronavirus. Now again we'll go back to the sequence of the events that has occurred as far as the COVID-19 is concerned. A report of World Health Organization China Joint Mission of Coronavirus Disease has reported the case fatality rate of roughly 3.8% in China. The case fatality rate, why it is important? That is the number of cases that are occurring, and in relation to this number of the cases, how many percentage deaths that are there. Hence it is not only essential to look at the figure of the cases of the corona, but also we will have to give importance to the mortality that is resulting because of the coronavirus. One of the interesting thing is naturally there is a mortality is higher among male as compared to the female. So roughly figure was that has been given in this report was 4.7% versus 2.8%. Higher mortality was reported more in patient with comorbid condition, and this is one of the point I want to discuss in detail when we will be seeing the further slide. Case fatality rate of 30.2 percentage that has been reported those having the comorbid condition, that is the cardiovascular disease. So if the person is having the cardiovascular disease and he is developing the infection, the as compared to the general population, the case fatality rate is approximately 13.2%. Case fatality rate, now second scenario we will take into consideration. Person is having diabetes and now he is developing the coronavirus. In such person, approximately 9.2%. In case of hypertension, it is 8.4%. Chronic respiratory disease and developing corona, 8%. Cancer patient, 7.6%. So death due to the COVID-19 in India per lakh population are 1.2, whereas the case fatality rate ratio is 3.1%. Somewhat variation that you will notice in the figure from the different sources, but roughly we have got the idea when we have seen these statistics in relation with the coronavirus till now. So as we have discussed about the comorbid condition, the second important thing that we need to give attention when we are discussing about the coronavirus is about the age. So it has been reported that people over 18 years, they are having the highest case fatality rate, as high as 21.9%. So every fifth person who is having the age more than 80 and developing corona disease, there is a chance of death. That has been whatever the scenario that have been studied, the statistics that has been studied, that give us idea. But although the elderly affected more, the severity of the disease in young age group should not be discounted, and this is again important thing. Yes, it is occurring more among the case fatality is more among the elderly, but there are some other figures, that is the 28% of the deaths from South Korea were reported in people under the 60 years of the age, and 50% of the cases requiring intensive care treatment in Italy were among the individual of the 50 years and younger. So one thing we can conclude, definitely the age more than 80, more than 70 risk is there, but simultaneously in younger population also the complication and mortality that has been observed as far as the corona is concerned. Up till now we have discussed about the origin of the coronavirus, whatever we have seen the photographs in relation with the animal market, that was live animal market that was there in China, Wuhan city, and around this Wuhan city the number of the cases, and suddenly at that time it was not known what is this it's viral disease or any other disease, but the people presented with the symptoms of the pneumonia or the respiratory distress syndrome. Now in the next slide we will be seeing about this coronavirus, what is the structure of this virus, whether there are any further types of the virus that are there, and then we will get idea about the exactly about this coronavirus, how it has been labeled as coronavirus. All these things that we will be seeing about the few microbiology related thing that we will be discussing as under the heading of the agent factor of the COVID-19. So what is this coronavirus? Coronaviruses are enveloped single stranded RNA virus. So the virus that can be RNA or DNA. So this is the RNA virus, and coronavirus were first discovered in 1930s in chicken. So it is not like that in 2019 only the coronavirus. We might in the textbook also we might have seen definitely 10 years back when the chicken pox was chikungunya fever was there as an epidemic in India, and you might have noticed hardly a paragraph that was there about the chikungunya fever in the textbook. Similarly, the coronavirus you can see in the previous textbook also, but whatever the current situation that is occurring in relation with the present structured coronavirus and diseases, very few things that I have been there. But this coronavirus was there, see, in 1930. Human coronavirus were discovered in 1960s, and the new virus, whatever the present coronavirus that is causing this pandemic, it was named on 11 February 2020 as a severe acute respiratory syndrome coronavirus 2. So remember, so what is current coronavirus that is causing the pandemic? What is the name of this virus? Is severe acute respiratory syndrome coronavirus 2, or in short we can call it as the SARS coronavirus 2, and the disease is labeled as coronavirus, or the short form is COVID-19. Again, this is one of the important sequence of the event as far as whatever the thing that we have discussed from the November 2019. By the 12th March of 2020, WHO has declared coronavirus as a pandemic. So you can go do your homework, read what is the endemic, what is the meaning of epidemic, and what is the meaning of the pandemic. So all over the world, more than one country that has been affected, and then pandemic that was declared by the WHO on the 12th March 2020. We should have also idea about the whatever the pandemic or the epidemic that has been declared by WHO previously. So these are the few diseases, few example that you can see in this particular slide. We have the chikungunya epidemic, then cholera, hantavirus, then monkeypox, Nipah virus infection, smallpox, tularemia, yellow fever, Zika virus disease. These are the few examples of the epidemic or the pandemic that has been declared by the World Health Organization. So again, we'll come to our main point, that is the coronavirus. So basically they are the 4 subgroups of the virus that are there, that is the alpha, beta, gamma, and delta, and these alpha and beta infect the mammals and rest infect the birds. So as far as the human being is concerned, the alpha and beta, they are infecting the mammals and they are transmitting this particular disease. 7 of these viruses can infect the people. Remember, this is again one of the important thing that you should know about the agent factor in relation with the coronavirus. The 4 common names are these 229E, NL63, that is alpha, both are these alpha, OC43, that is beta, HKU1, that is beta, and the 3 less common causing severe illness are the Middle East Respiratory Syndrome, MERS, and then these severe acute respiratory syndrome, that is the SARS. Already you might be familiar about this particular name. But what is causing this pandemic? The virus that is named as a SARS coronavirus 2, it is again a beta virus which is causing the COVID-19. So I hope you now got the idea in relation with the origin of this virus from this animal market in relation with the China. Then we have discussed about the agent factor of this particular disease. So as I have said, whenever you are discussing about the epidemiology of any disease, the 3 heading you should not forget. You should not forget the epidemiological triad. So the first angle of this disease that we have discussed is about the agent factor in relation with the COVID-19. So we are aware now that it is a viral disease. The disease is caused by the coronavirus and the SARS-CoV coronavirus 2 that has been named, that has been given to this particular disease, what we call as the COVID-19. So in this diagram you can see the thematic structure of the coronavirus, and the under electron microscope, if you observe, this is what is the structure in relation with the coronavirus. And if you go into the detail, though, so if you again see this particular figure, here you will get idea that what is the in detail structure of this coronavirus. There are spike protein, then envelope is there, and here you can see repeatedly in many few days you might have heard the hand wash with the sanitizer and all this thing. Why it is necessary? The gray coating that is there for this virus, that is the envelope, it is mainly composed of the lipids, and which can be destroyed with alcohol and soap. So here you can understand the importance of repeated hand washing with proper sanitizer. And then there is a yellow deposits envelope E protein is there, and the orange deposits are the membrane protein. So this is in detail in relation with the microbiology of the coronavirus is concerned. Again, if we see the sequence of event or summarize the sequence of event that already we have discussed, that is the 17th November 2019, the cases that has been reported in Wuhan, China, they have been believed to be the zoonotic origin, as most of the cases that has been reported around this animal market in China, and it has been suggested that it has been emerged from the from these bats and called as the bat-borne virus. Now when we study the epidemiology of disease, the next important thing, why this disease has occurred in Wuhan, and then initially the epidemic in China, and later the worldwide the pandemic that has occurred. So here in this diagram we can get the idea. So here we can see the animal market of this China. This bat, they are infected, basically, as we call it as zoonotic infection. The infection has passed to the human being, and from one person to the other person. You should also go to the basic epidemiology topic. You should see what is epidemic. There are different types of the epidemic are there. The point source epidemic, the propagated epidemic is there. You should have knowledge in relation with these different types of the epidemic, and here we can say whatever the type of the epidemic that we have seen in the initial stages is the propagated one. Human being infected, and then he is giving the infection to another 10, and these another 10 they are giving the infection to the they are infecting 10 person. So what is happening in the last 2-3 months is the multiplication of the cases. Initial stage there was summation was there, the 5 cases, and then next day the 2-3 cases that are added. But later on, when the infection reached to the epidemic proportion, then the multiplication of the cases that has occurred. You can refer the figure of the last 2-3 months, plot the graph, and then you can get the idea how this propagation of the coronavirus infection that has occurred. Already we have discussed the agent part. As far as the host part is concerned, all ages and both sexes are affected. The first in few slide we have seen that the male are affected more as compared to the female. There is no pre-existing immunity, as this is a new infection. Definitely those who have suffered from the coronavirus and recovered, they will have the antibody, and they will have the immunity in relation with this particular disease. One of the thing, already when we have seen the problem statement in relation with the coronavirus, we have noted one of the host factor that is affecting the mortality, or that is deciding the mortality of the corona, is the in host. If there is a comorbid condition is there, which are the comorbid condition that already we have discussed. One of the thing, most of the time we ignore our lifestyle, and in UK also the report is there, who are the most suffered person from this coronavirus, those who are obese. And the obesity is one of the major risk factor as far as the corona is concerned. If you are overweight, if you are obese, then there are more chances of the complication that have been reported in such person. Even taking these into the consideration, the UK Prime Minister, UK Health Ministry, they are now running the anti-obesity campaign. So the obesity and overweight people, they were definitely at higher risk as far as the coronavirus is concerned. Hypertension condition: cardiovascular disease, diabetes, liver diseases, immunocompromised condition. These are the few things that has having higher risk. Already we have discussed the age and coronavirus infection. So here in this graph you can see the risk as far as the age is concerned, and see those who are more than 60, particularly the more than 80, they are having the higher chances of the mortality as far as the corona is concerned. Host factor: cardiovascular disease, diabetes, chronic respiratory disease, high blood pressure, cancer, and all these conditions will occur. They are more prone in the obese person. So the obesity is again one of the risk as far as the corona is concerned. Now when we study the epidemiology of the disease, as I have said, the next thing after knowing the agent factor, the host factor, we should concentrate on the how the transmission has occurred. Now everybody of we are aware there is a human to human transmission that has been reported as far as this virus is concerned. The case which has been confirmed on 20th January, and later on in March the WHO has declared the pandemic. So naturally the overcrowding is one of the important factors that determines the spread of the infection. If you look at the number of the cases that has occurred in India, initially the corona was limited to the municipal corporation. So whatever we have seen, we have observed the number of cases more in Mumbai than in Pune as far as the Maharashtra is concerned. But what has happened after the 24 days a strict implementation of the lockdown, then human movement that has taken place, and now it is not like that the coronavirus is the urban disease. Even rural area also we are seeing the many other districts where the cases were negligible, like Aurangabad or many other districts, they are having the significant rise in the number of the cases. So one of the thing we can see is whatever the migration that has resulted later on, that has now that is also causing the cases in the rural areas also. They are also affected because of the coronavirus. The route of transmission is definitely the human to human transmission is there. And the next thing that we will be discussing in relation with the prevention is about the social distancing. So those people who are in close contact with the asymptomatic, or we'll see the definition in relation with the asymptomatic case, what is the case of the corona, we'll clear that concept. So those having the close contact less than 6 feet, they are at more risk. So that is one of the important route of the transmission. Then since the start of this disease, we are giving the stress on the hand washing and all these things, touching the surface or object that has virus on it, and then if the person touches this hand to mouth or nose, there is again or even the eyes, there is a possibility of the transmission of the coronavirus is there. Virus may be present in the aerosol. There are current reports from the WHO about the airborne transmission of the coronavirus. Man to man transmission is the thing that is happening. There is no extra human reservoir as far as the corona is concerned. Hope you have understood about the agent factor, host factor in relation with the coronavirus. We have discussed the mode of the transmission of the coronavirus, and whatever the preventive thing that you might be hearing about the coronavirus prevention, you can understand, you can correlate this thing in relation with the agent factor that we have discussed. The next thing we'll be seeing about what is the incubation period of the coronavirus, that is the entry of the organism, what signs and symptoms that we are going to see as far as the coronavirus infection is concerned. After incubation period, we will be discussing about what are the clinical features of the corona. As we have said, there is a type of the presentation that can be there as far as the coronavirus is concerned. There might be mild cases, moderate cases, and the severe cases. We'll also discuss about what likely complication that can result and the causes of the mortality as far as the coronavirus is concerned. So here you can see roughly the incubation period ranges between the 2 to 14 days, with the majority presenting the showing the signs and symptoms 3 to 7 days. Median incubation period is roughly 5.5 days, and the susceptibility can be reduced greater extent by following certain special means, like in the case of the COVID by doing the social distancing. So last 3-4 months, the using mask, social distancing, using sanitizer and all these things that are repeatedly bombarded, but you can understand the importance of all these things. Period of communicability, exact period is not known. Still we are trying to understand the natural history of disease. When I use the word natural history of disease, there is still gap in our understanding of the epidemiology of the corona, that is the pre-pathogenesis and pathogenesis phase, what we call as the natural history of disease. Still we are many studies that are going on, and we are trying to understand the coronavirus. So roughly we can say it is around 17 days, and extent and duration of the immunity and the antibody formation, that will also decide the communicability of the disease. Now these are the few epidemiological terms and definition you should aware when we are learning about the coronavirus. The thing that you might have heard about the in corona positive cases is the asymptomatic cases. What is the asymptomatic cases? If we don't test these people, their status can never be known. But the WHO in his report has mentioned that the 20% of the person may remain asymptomatic. That is, they are having these infection, but they are not showing any signs and symptoms. Then the next type of the is the pre-symptomatic cases. So who are these pre-symptomatic cases? These are the cases harboring the virus in them within the incubation period. Now they are in the incubation period, so the entry of the microorganism is there, they are having the infection, and now as they are in the incubation period, in future they may show the signs and. But what is the danger of these pre-symptomatic cases? As we have not done the test, as they are not showing the signs and symptoms, we are not aware they are the corona positive, and they are spreading the disease into the community. So whatever I have given the stress, that is the multiplication of the virus, multiplication of the cases that is occurring, daily 50-60,000 cases that are occurring, and it is because of these asymptomatic or the pre-symptomatic person. We are not knowing they are corona positive, we may come in contact with them, and then the spread of the disease that is occurring. So the screening of the asymptomatic patient is also very difficult, because they are not showing the signs and symptoms, and we are not suspecting them. 80% of the COVID-19 cases may remain asymptomatic, and here also we will get the answer why this disease is spreading rapidly. The third thing, that is the confirmed cases of the coronavirus. A person from whom the reports of laboratory testing COVID-19 are confirmed, irrespective of their clinical presentation. So if the test is positive, definitely we can say it is the confirmed case of the coronavirus. Now there are also some definition that has been given as far as the COVID is concerned, that is the suspected case. Since the beginning, if there is definitely the history of travel is there from the foreign country where the coronavirus that is present, we should test such person, or the person who is in contact with the confirmed COVID cases, definitely that will be the suspected case. So whatever the importance that we are giving to the contact tracing as far as corona, that here we can understand. Or the person presenting with the severe infection, he is having pneumonia, respiratory distress syndrome, or the person requiring hospitalization, definitely such person is we consider as a suspect case of the corona. Now we'll come back to the clinical features of the coronavirus. What features? Last 5-6 months, whatever the various presentation that we have observed in relation with the coronavirus, and if the person is having this infection, what are likely clinical signs and symptoms he can present? Here we can see in this particular slide. First thing is definitely he will have the fever. Any fever cases nowadays we are suspecting as a corona, and we are giving the stress on testing. Second thing, the tiredness, dry cough. Some patient may have the ache, pains, nasal congestion, runny nose. Recently, this particular symptom that has been reported as far as the coronavirus case is there is a loss of smell and taste. Then also you can suspect the corona. These symptoms are usually mild and they begin gradually. most of the people, that is repeatedly I have said this particular thing, 80% recover from disease without needing the special treatment. So remember this particular thing. There is no need to spread the panic. Many rumors that has been spread recently in relation with the coronavirus. So what is importance to understand the disease? 80% may recover, they may not need the treatment. Around 1 of every 6 people who gets COVID-19, they may become the serious ill and they may have the difficulty in breathing. So roughly whatever the thing that we have discussed as far as the coronavirus clinical signs and symptom is that the person can present with fever, he may have the cough, he may have the shortness of the breath, or he may have the difficulty in breathing. There are in few cases the gastrointestinal symptoms that have been also been reported. And if the person land up into the complication, if we develop the severe complication of the corona, then in severe cases you can see the pneumonia. In some person, the severe acute respiratory syndrome that has also been reported. In few cases the kidney failure, and definitely the mortality is also possible in if the person develop the such complications. So this is what is the summarized in this particular diagram, the coronavirus cases, then their common signs and symptoms, and whatever the presentation of the severe cases of the coronavirus that will be there. Now we will see about the severe illness in the corona. In mild illness we have seen the just the fevers, cough, loss of smell, taste sensation that is there. But if the person develops the complication, there might be the acute respiratory distress syndrome. You might have heard this word nowadays, that is the cytokine storm that is also reported in the cases of the coronavirus cases. If the person is having acute respiratory distress syndrome, the person may land up into the sepsis, septic shock. And again the recent report that have shown that is the clotting, the blood clot that may present in the person having the coronavirus infection. He may develop the multi-organ failure. Roughly the presentation of the coronavirus we can summarize in this graph. The more than 80% will have the mild infection. 10 to 15% of the cases, roughly 13% of the cases, they may develop the severe infection who need the hospitalization, and hardly less than 5% of the cases they will have the critical condition, may require the ventilator and facility. COVID-19 test. Now this is one of the important part that we will be discussing. Various laboratory tests that are available as far as the coronavirus is concerned. You should know, you should aware about this test. One of the thing that you might have heard is the RT-PCR test. The full form is real time reverse transcription polymerase chain reaction. So the RT-PCR test, these are commonly used all over the India as far as the diagnosis of the coronavirus is concerned. The basic thing you should know is they are used to directly detect the presence of virus rather than the antibodies. So these are the direct tests, these are not the indirect test, RT-PCR test. And this virus detects the viral RNA of this virus. So RT-PCR tests, they are important as far as the detection of the corona is concerned. And remember, this test proceeds by converting the RNA. We know the corona is a RNA virus, but now this test will convert this RNA into the DNA. And if you read the polymerase chain reaction, the steps of the polymerase chain reaction, you will understand how the multiplication of this, even the small sample, we can multiply this virus, and then we easy diagnosis is possible because of the polymerase chain reaction. So the reverse transcription that is occurring, and then we are detecting the virus. Where from we should take the sample? For this, a sample is collected from the deep inside the nose or the back of the throat with the help of the swab, and then we are sending this sample for the RT-PCR test. Another thing we should aware, what is the time that is required for this doing this test? It is hardly 3 hours. Within 3 hours we can get the result whether the person is corona positive or negative. Another thing, important thing, what is the cost? Initially the cost was higher, more than 4,000, but if you go through the recent government circular or the GR, it is recommended, the price is ranging between the 1,900 to 2,500 rupees for this particular test, RT-PCR test. Second thing in news nowadays is the antibody testing. this is important to know the extent of infection in the community. If you are reading the newspaper recently, you might have read the news of Aurangabad, where these rapid antibody, even in the Pune also, there is a rapid antibody test that has been carried out, and that has shown the extent of infection that is already there as far as Aurangabad or Pune is concerned. So what is this rapid antibody test? As we have seen in RT-PCR test, what sample we require? We require the nasal or the throat swab. Here in antibody test, we require the blood sample for the detection of this antibody, and the tests are not 100% reliable. So if these rapid antibody tests they are positive, the person should advise to go under for the confirmatory RT-PCR test before the treatment. Underline this particular sentence. Then rapid antibody test, we are taking the blood sample from the finger, and if you have learned the immunology in second year, you are already aware initially the IgM antibodies that will form, and they indicates the early infection, and later on the IgG antibody that will form they in the latter stage of the infection. Time and cost, that is it required hardly 20 to 30 minutes, and roughly it cost 500 to 600 rupees. Test rapid antigen test, and require the 30. Now Providence have also given the immediately responded to this COVID pandemic. Then a microbiology department is in relation with this corona at the microbiology department of health sciences. A TrueNet machine is a chip based small portable machine. It detects the virus from the nasal or the oral swab, and it is equipped to detect the RDRP enzyme found in the RNA virus. It requires approximately 60 minutes. When we are carrying this test, in the first step we may detect the E gene. If the test is negative, we can leave the person. If the test is positive, the first step is that we are detecting the E gene. Again further we should do the test RP gene, and if this RDRP gene that is found, person. Next part of this particular lecture is about the prevention. To revise what we have discussed: origin of the virus, how it has reported in China. Then in March, the WHO has declared the pandemic. We have seen about the agent, host, environmental factor, the epidemiological factors in relation with the corona. We have discussed about the mode of the transmission of the coronavirus, how it is spreading into the community. We have discussed about the clinical signs, symptoms, feature. Main thing we have to remember in our mind, there might be presentation of the mild, moderate and severe type. More than 80% will be either asymptomatic or they will be recover without treatment. In 10-15% cases only the complication that will be there, they may require the hospitalization, and less than 5% cases develop the severe complication because of the corona. The last and most important part that we are concentrating, that we should know about the preventive strategy and control strategy as far as the coronavirus is concerned. When we are concentrating on the prevention, our approach should be on the, we should concentrate on the three things. First, intervention that should be directed to the control or eliminate the agent as a transmission source. Then protect the entry into the host, and the third thing that we can do is the increased defense mechanism of the host. So if you understood the importance of agent, host, factor, this epidemiological triad, the same thing we can apply when we are planning prevention of any disease. Control, eliminate the agent as a transmission route. So what is necessary? The strict enforcement of the Epidemic Act 1897, then the strict enforcement of the Disaster Management Act 2005. As far as the these are the things that you might have observed that has been done in relation with the prevention of the coronavirus. The lockdown is one of the concept that you might have heard recently only, and that has been tried in relation with the prevention of the coronavirus infection into the community. Division of the areas. Again, these are the thing. If you read the newspaper, if you see the television channels, you might have divided into the different zones, like the containment area. You might have also heard about the Arogya Setu app, that is the alert system. You may know the corona cases that is in your vicinity. Then identification. What is most important now is to identify the pre-symptomatic, asymptomatic cases and the contact of the person. Now you have detected the one case, you will have to do the contact tracing, that is principle that is followed in epidemiology, to know earlier diagnosis of the corona and to prevent the further spread. Already all of you are aware the preventive measure that we are adopting for the coronavirus prevention, and that should not be undermined, that is the washing the surfaces, cleaning of the vegetables, fruits and other eatables, as we have seen the mode of the transmission of the coronavirus. How the host can be protected, how we ourselves can protect from this coronavirus, that is the self protection by the face mask. If you go through the various medical journals, one of the study that I have come across is by Jayant et al. In that study, he has concluded that the wearing face mask in public is the most effective mean to prevent the human to human transmission. So using mask, we should not ignore this particular thing. Then when simultaneously applied with the measures, it is not the only thing. What we are practicing is social distancing. We know how the virus spread from person to person. Quarantine, this is one of the word you might have repeatedly heard in last 3-4 months. You should go the what is the exact definition of the quarantine that has been mentioned in the book. Contact tracing, all these are the efforts for the prevention of the coronavirus. Hand hygiene is important, and social distancing for the prevention of the coronavirus, that is important. As the virus has begun from the one itself, the word one itself has given the message for the prevention of the coronavirus. W stands for the washing your hands, U stands for the use mask properly, have temperature check regularly, then avoid large crowd, overcrowding, never touch your face with unclean hand. And if you follow these 5 things, definitely there will be success as far as the prevention of the corona is concerned. The next category that are at higher risk are the healthcare workers. So for them, use of personal protective equipments, gloves, long sleeve gowns, eye protection, N95 mask, adequate ventilation in the room. These are the few important things that can be recommended, and this diagram that can give you idea, there are the steps how you can have the personal protective equipment, how the healthcare person they should wear these equipment. Another thing, as we have discussed the obesity and all these things, that is an important risk as far as the corona is concerned. So we should not neglect our lifestyle, whatever the practices that we are following, prevention of overweight, prevention of obesity, all these things that are in our hand, having simultaneously good sleep, yoga, meditation, healthy nutritious food, boosting our immunity, that can give the strong defense mechanism of host as far as the prevention of the corona is concerned. Health education, already it is going on through the various news channel on the net. Even you are hearing this tune of this prevention of the coronavirus whenever you call any other person. Medicine, this is the part that we will be discussing the next. Vaccine, they are again in the trial phase. Hope we will have some vaccine at the end of this year. Then prevention remains again the main strategy. As you know, as far as the public health point of view, these are the word that you might have heard, the containment zone. What practices that are followed in this containment zone, that is the isolation, quarantine, active surveillance of these respiratory infection cases, self-reporting, closure of the schools, offices and colleges. That's why we are having this online lecture instead of having the lecture in blue or grey hall. And then refrain from the leaving the home border measures. All these things you might have observed in last few months that has been practiced for the prevention of the coronavirus. There might be, if buffer zone also, in this buffer zone we can practice the isolation, enhanced self borderline measures that can be taken. Mobile specimen, already we have increased testing can improve for the early detection of the cases. Enabling care of the patient, now the person is having the COVID, required is the having beds. If the person, we should have the sufficient number of personal protection equipment for healthcare. 100 for corona. The rumors that has spread, some stigma for the corona, that need to be avoided, and in severe cases we'll just overlook of the treatment that we will take in this lecture. We are not going into detail, but the fluid therapy, oxygen support, ventilator, that might be required. As far as the medication of the coronavirus, there is no any new drug. Already the whatever the drug that are tested for other diseases, that we are making trial, we are carrying out the clinical trial as far as the prevention and control of the corona is concerned. At least you should know the name of these drugs, that is the remdesivir, chloroquine, hydrochloroquine, favipiravir, lopinavir. Initial result from the randomized trial in United Kingdom, they have also reported the dexamethasone or the steroid therapy, they have reduced the mortality in 1/3 of the patient. So again, these are the trial error that are going in last 2-3 months. Various drugs that we are using, some are showing effectiveness, some are showing the side effects. Tocilizumab, this is again one of the drugs that trial has been carried out. The ivermectin, you might have heard in the newspaper, that is this trial also has been done as far as the corona treatment is concerned. One of the important thing, zinc is a cofactor for the immune response. So the boosting immunity, we are giving various cocktail to the patient who is having the corona positive. So for the boosting the immunity, the importance of the zinc already is there, that can be used for the treatment. Routinely we are giving the vitamin C or the vitamin D, even the simple sun exposure, that is regular daily sun exposure, that will help you in prevention of the vitamin D deficiency. Recent reports are there that, as already we have discussed in clinical features, the clotting that has been happening in the patient in who has developed the complication. So anticoagulants are also tried for the corona COVID-19. This is again one of the thing you might have read in the newspaper, that is the use of this convalescent plasma therapy. It is tried in the at various hospital, but when you are selecting the donor for this plasma therapy, donor should have high titers of neutralizing ELISA antibody in his serum. Clinical trial that has been carried out in relation with the effectiveness of the BCG vaccine and coronavirus infection. Last most important thing is, if you have to take the information, whatever the information that I have gathered up for preparing this PowerPoint, that is from the authentic website. These are the few sites that will help you give the authentic information as far as the coronavirus, that is the Ministry of Health and Family Welfare India. WHO site is there where you can get the infection. Even the health minister, they are having their official information. The PIB India, this is one of the site where you will get the official information as far as the coronavirus is concerned. So thank you. What we have discussed in today's lecture, I hope you have got the idea in relation with the epidemiology of the coronavirus, origin of the coronavirus, agent, host, environmental factor that we have detected. One of the conclusion that we can draw, the 80% of the cases may be asymptomatic, they may not require treatment, they may recover. 10 to 15% cases, they are developing some complication, may need hospitalization. Less than 5% of the cases, they are developing the severe complication like acute respiratory distress syndrome or the pneumonia. Next thing you should know when you are learning about the corona is what we have discussed is the laboratory tests that are available for the corona. One is RT-PCR, second is the antigen test that we are carrying out in relation with the corona, and to know the extent of infection in the community, we are carrying out the antibody test. And the last part in this lecture, we have discussed about the preventive strategy. Hope I know last 3-4 months everybody of you are aware about the preventive strategy in relation with the coronavirus. As far as the medication is concerned, already available drugs like the chloroquine, hydroxychloroquine, the drugs that we are using for as antiretroviral medication against the HIV/AIDS, we are trying various trials that are going on, and also the various trials in relation with the vaccine that are also going on. As you know, the clinical trial goes through these 4 phases, and some are in the second, third phases. These vaccine that is there. Hope we find some vaccine, and definitely will able to control these whatever the pandemic that is resulting because of the coronavirus. Thank you very much. आवाज होता ना. हो.